Hey guys, time for another exhilarating video over one of your favorite topics, hemodynamics. And so these are practice questions, and these are for the complex groups. We do not do hemodynamics in adult, even though don't I wish we did. It's so exciting. And wouldn't you want to just spread that love out among multiple semesters? But it's not in my hands. So hemodynamics can be a really tricky topic for a lot of people. So I've created some practice questions because a lot of times students are just like, how would this be asked in a question, or what kind of questions? So I can't guarantee everything on here is exactly how your questions will be worded. And no matter what time, when I've given a bunch of different types of practice questions to students, and they're always like, the tests are different. And I think there's just something scarier about them because they're a test. You're being graded over them. But hopefully this will give you an idea of some ways questions could be worded or what these questions are asking. Remember, at the end of the day, your professors are your end all be all. So whatever they say goes. So please do not say, well, Miss Woodruff said, this, unless if you're really serious or have a concern, you can come to me and ask me. Maybe I probably made a mistake, but there's always the world of gray when it comes to analyzing some of these questions. So hopefully these are helpful to you. Look at the test taking strategies, and you can look at the content too. But really, sometimes at nursing school, the best thing you can do is figure out a strategy to make it through. So let's get in, or attempt to, and fail miserably. Okay. All right. So question number one. It says, a nurse is caring for a client on a norepinephrine infusion. Drugs. Based on the data below, what is the nurse's best action? So then I have some data. I see their blood pressure is 95/60, and that I have an order for the continuous norepinephrine titrate to keep MAP greater than 65. So this question's asking me to do is seeing if my norepinephrine is therapeutic. And so it's saying, like, because if you look at your answer choices, I'm either going to keep it the same, increase it, decrease it, make no changes, or stop it. And so I have to see where I'm at with this drug. So then I need to go back and look at the question. So it's saying, what's my best action? And it's saying my order says to titrate to keep the MAP above 65. So that means I'm going to have to calculate my MAP. And this is possible in a question that your professors could expect you to figure out how to, or have to ask you in some way, shape, or form to calculate a mean arterial pressure, or MAP. So the MAP is kind of the average blood pressure overall, and usually above 65 is really great for kidney health, and above 70 is great for brain health. And so we like it higher. Most of the time in real life in the hospital, most medications are going to be titrated to keep a MAP greater than 65. So if you don't know, we calculate the MAP by taking the systolic blood pressure and then adding that to 2 times the diastolic pressure, and then divide all of that by 3. So if we do this, I find that with this blood pressure, I have a MAP of around 71. So if my MAP is 71, where am I at? Am I good? Am I high? Am I low? And it looks like I'm trying to stay above 65. Well, 71 is above 65. So at this time, it looks like I don't need to make any changes to my infusion. So right now, I don't have to make any changes, but it does say to titrate to keep MAP greater than 65. I'm at 71. So officially, I'm above that 65. So I could decrease the infusion. But per this order, that's going to be the best action. So I'm sorry, I know that was confusing. I know it made it seem like the answers are that, like, hey, the answer is C, but the best answer here would be to decrease the infusion, because right now I am 6 or almost 7 points above what I need to be. We always want to be on the least amount of norepinephrine as needed, because this medication can lead to tissue, tissue and cell death. There we go. But let me back up a little bit because maybe I got confusing. So effectively, my MAP is 71. It's higher than what I need it to be because all I need is a MAP of 65. So what I can do is I can titrate down or decrease my infusion, and that way that I'm getting closer towards that goal MAP of 65. I don't want to increase my infusion, because if I increase the rate, it's going to increase that MAP, and my MAP is already higher than what I need it to be. I could make no changes, and in real life, maybe you would make no changes, but this is perfect nursing school world, and we got to follow our orders to our T. And we definitely want to make sure, in real life too, you really want to watch that closely. Again, you want to be on the least amount of this medication as possible. And then I don't need to stop the infusion. There's no problems. It's actually, things are going well, like their MAP is good. So there's no indication to stop it. So the best answer here would be to decrease the infusion because I'm on more than what I need because my MAP is higher than that goal of 65. Hopefully that makes sense. I didn't talk myself into a corner. So question number 2. The nurse is caring for a client with cardiogenic shock. Don't worry, there's a different PowerPoint on shock too, if you're struggling with shock. They note the findings below. What medication should the nurse initiate first? Oh no, more medications. Blood pressure 80/40, that's low. Heart rate 105, that's high. Cardiac output 3.1, that's low. Central venous pressure 4, that's normal. And so the first thing to do with hemodynamics, and I think it would help, and I know you can't do this on your exam, is kind of write out like what direction things are going. And if you have like a cheat sheet note card or something you're allowed to have for your exam, definitely writing out those values helps to kind of know what the normals are with hemodynamics. And then I like to do arrows and just kind of put, is it high, is it low, where are we at? So I need to see what I need to initiate first. And a question like this means like, hey, there may be more than one thing that maybe I need to do multiple of these things, but which one is going to be most helpful or which one do I need to do first? So it looks like I have low blood pressure, a high heart rate, low cardiac output, and a normal central venous pressure. So then I can look at this and I could see maybe is there any that I can cross out? Well, if my CVP is normal, I don't need fluids. So I could cross out D because I don't need fluids if my CVP is normal. And the normal CVP per your textbook, not in real life, is 2 to 8. And so the other choice is to give a vasopressor. Well, that sounds pretty good. Their blood pressure is low and their cardiac output is low. And so maybe that would help with that. But then I have to go back to the question. And the question says the nurse is caring for a client with cardiogenic shock. And if they're in cardiogenic shock, this is a heart pumping problem. So if I give a vasopressor, it may help to increase their blood pressure, but it's not necessarily going to help with their cardiac output because it's not going to help their heart to pump better. So, I mean, I might need that, but I don't know if that'll be the first thing I want to do. And so they have a vasopressor and then a vasodilator. So what do you call them? The vasodilator, if their blood pressure is already low, that's not going to help and that could actually make things worse. So I'm going to cross that one out too. And so then I have a positive inotrope as my other option. So that's a medication that helps increase my heart squeeze. So then again, I have to, so if I'm down to B and C, and let's say that I'm down to these, I'm like, oh, which one am I going to do first? Well, I want to do the one that's going to have the most bang for its buck. If I can increase the amount of heart squeeze that a patient in cardiogenic shock has, they can put out more, put out more flow or get more blood out, which can then therefore help their blood pressure. So a lot of times, you can look at this backwards and be like, oh, I need to get their blood pressure up first and then their cardiac output will improve. But if the problem is resting in their heart, that their heart's not pumping the way that it's supposed to, I need to start there. And so they need a positive inotrope, and that's going to help fix their other problems. And then their heart rate will probably come down because then their blood pressure will be up, which is going to help because most likely their heart rate's up because their body's working so hard and that sympathetic nervous system is trying to kick in because my cardiac output's low. So once I fix the underlying problem, I always have to see what's the underlying problem with the hemodynamics, what kind of shock is it, or what's the issue here? Because a lot of times hemodynamics, they can have a lot of numbers that are off, but what's the main problem? Who's the guy that if I fix the one guy, then the other problems can be fixed? So yeah, so the correct answer here would be B, to give a positive inotrope. 3, a nurse is administering intravenous fluids to a client with septic shock. What is the expected outcome for this medication? So this is another way we can ask a question is that we could ask, how are medications going to affect my hemodynamics? So with fluids, I have to think, okay, which hemodynamics are fluids connected to? And they're connected to CVP. But let's keep looking just to make sure there's not a trick in this question. So would I expect their CVP to be increased? Yes. And that's what I would be hoping for. And when it says expected outcome, think this is what I'm hoping for. Like, this is what I want the medication to do. So when you look at this, a lot of times students can get confused because sometimes they'll choose the answer. Like, let's say that this said, A nurse is administering furosemide or a diuretic. What's the expected outcome? A lot of students will choose something like that they're going to urinate a lot. Well, that's an effect of the medication, but that's not the outcome I'm hoping for. When you think outcome, this is what I'm hoping for. This is what I want to happen. This is the fix that I'm looking for. So like with intravenous fluids, one of these answers could be that they're peeing more. Like, okay, well, that's good. You know, like that's good that they're peeing more, but it doesn't necessarily, that's not necessarily what I'm trying to do at the end of the day. Like, you know, it's something like, I know I am trying to maybe help their kidney function, blah, blah, blah. But what I'm saying is that I'm not sitting there and being like, oh my God, I hope they pee a lot with this. So like, try to think that as like, you know, like, oh, like, what am I really hoping for? Like, you know, that the same thing with diuretics. I'm not like, oh, I hope they're going to pee a lot with this. I'm saying, I hope this gets the fluid off of them. At the end of the day, you always want to think about, like, when you're thinking expected outcome, what are you hoping for? What's like the end goal that you're like, oh man, I really want this to work. Because now I'm going back and I'm like, man, I guess with fluids, I do want them to pee. So maybe a better thing would be like, with intravenous fluids, that it's going, well, I'll keep going because I think some of these answer choices will help better explain what I'm saying there. So the client's, the second choice is the client's SVR is increased. So SVR is that vessel squeeze or systemic vascular resistance. It's how much resistance in the blood vessels that there is that the heart has to overcome to pump blood forward. And so it's pretty much how constricted the blood vessels are. So I wouldn't expect with more fluids that there would be more constriction. I don't think that that's going to happen. The client's MAP is decreased. Well, if they have more fluid, I would think that their MAP is going to increase, or there's going to be higher blood pressure. Because remember, the mean arterial pressure is like a average blood pressure. And so for a client with septic shock, I would actually think their MAP would be increased. Then the client's cardiac output is decreased. That's also another one that's like, hey, if they have more fluid, they're probably going to have, so part of cardiac output is you have to have fluid in order to get stuff pumping forward. So I would think that fluids would actually increase it. So I guess I changed some of these answers, but you know, the key here is that, you know, with any medication, there's lots of things that it can cause or do, but I have to think about, why am I giving it for this patient? And so that's what I really want to just hit home, is you always want to think about, okay, who's the patient that I'm giving it to? What am I hoping to happen for them? And I'll stop saying the same thing over and over. So, but the best answer and the only correct answer here is going to be A, that their CVP is increased. It's question 4. A client has a central venous pressure of 18 milligrams of mercury. Which order would be most helpful for this client? So here I have, now it's kind of doing it backwards. It's giving me a hemodynamic and saying, what order do I want? So I have a CVP and it's 18, and we said the normal is 2 to 8. So that's very high. So if I have high CVP, I have a lot of fluid. So it's saying which order is going to be most helpful to get rid of fluid. So dopamine continuous infusion. Well, this is a medication that's going to help increase my heart squeeze, my contractility. That might move some fluid forward, but it's not going to be very helpful if I just have too much fluid in general. It doesn't get rid of fluid. Norepinephrine, well, that helps to squeeze my blood vessels and constrict them, but it does not help to get rid of fluid. Intravenous fluids, continuous infusion, definitely don't want that. And a lot of times this is what you're going to see. You're going to see one answer, at least one answer in there that's the opposite of what you want. So if you didn't know that that CVP is high, a lot of students might choose this because they don't know which direction that we are. And so then the last choice, which has to be the right answer, is the bumetanide, which is Bumex, which is a loop diuretic intravenous push. So this is the only answer that actually would make sense. It is a diuretic. So if my CVP is low, I need fluids. If my CVP is high, I need diuretics, get that extra fluid off, help to pull some of that fluid. So the most helpful thing for this client is going to be the bumetanide. And so again, when you see anything that has most helpful, you always want to think about what's going to be most direct, most useful, or going to really add the going to get to the bottom of the problem for this patient. Question 5. Ooh, lots of words and acronyms. A client is being admitted with cardiogenic shock. Which hemodynamic values are most consistent with this condition? So another option here that they could do in an exam is they could give you a bunch of, they could give you a condition like cardiogenic shock and say, what are the hemodynamic values that are going to be associated with this? And a question like this, again, that's going to be one of these great times where you want to write stuff out. So first things first, I know for all types of shock that cardiac output is going to be low. So I can already cross out B and D because I know that my cardiac output has to be low. So it helps to kind of cross some of these out so you don't sit there and read every single one and lose your mind. So I'm down to A and C. So I like cardiac output low and I like blood pressure low because those are both, like, that's true for both of them. For every type of shock, there's low blood pressure, low cardiac output. It looks like the only thing that's going to differentiate for me is my CVP and my SVR. So I need to either decide, are both of those low or are both those high in cardiogenic shock? So with cardiogenic shock, this is where there's a pump problem. They're unable to pump blood forward. So there's usually, it's like heart failure, like an accumulation of fluid. So I would think their CVP would be high. And then also because they have the low cardiac output, then their blood vessels constrict and their SVR gets high too. So the correct answer here is going to be C, that their cardiac output is low, blood pressure is low, CVP is high, and their SVR is high as well. The other one, A, would be true for something like hypovolemic shock. And you also can have that in septic shock as well. So question 6, a nurse is caring for a client who is recovering from a CABG, coronary artery bypass graft, and has a pulmonary artery catheter. Exciting. What information most accurately describes the purpose of this catheter? So this is another question that can be given when it comes to hemodynamics, is that you as the nurse have to know how to manage the equipment or the devices that measure or tell us what hemodynamics a patient has. So we're trying to answer what is the purpose of a pulmonary artery catheter. So does this give continuous blood pressure reading to titrate medications? That sounds more like an arterial line, not a pulmonary artery catheter. So I'm going to say no and keep going. And by the way, look in the question too, it says most accurately describes, which means some of these might be kind of right, but which one's the best? Okay, so the catheter provides information about how well the coronary arteries are being perfused. Well, this is a pulmonary artery catheter. It's not in the coronary arteries. So I don't think that that's the best description of how well they're being perfused, because that doesn't even seem like something that exists. So I'm going to say no. This catheter gives pressure readings and information about fluid load on the heart. Well, I like that. I know that the pulmonary artery tells us like what's going on the left side of the heart, and how the fluid, something about fluid with the left side of the heart. So I like that one the best so far. And then this says this catheter allows for monitoring of electrical changes to your heart after surgery. That sounds like an ECG monitor. So I don't think that that's what this catheter does. So you can see here, all of these are devices or similar things. I don't know about B, but that may be used. They're using terms that you may be familiar with. And this is where a lot of students can get confused because they're like, ooh, I know there's something about that. But you have to think about what is this specific catheter? What does it help with? And a pulmonary artery catheter sits in the pulmonary artery, and it helps to give a picture of how the left side of the heart pressures are doing. And so that helps to give us a better idea of how the left ventricle, which is your powerhouse, how it's functioning, how the fluid load is. Is there a lot of fluid or not enough fluid? What's going on? So this definitely helps to keep things, monitored during this time, especially right after this very, very big procedure. All right, last but not least, a client is receiving a continuous phenylephrine infusion. Which finding would warrant the nurse to make a change to this infusion? So this one's requiring you to know what phenylephrine is, and it's also requiring you to know what's a sign that it's working or what's a sign that it's not working. So you definitely need to know about like what parameters and stuff are related. Like when I'm titrating a dopamine drip, what hemodynamic value am I looking at? So with phenylephrine is a vasopressor. So I'm going to be looking for something that's going to tell me about the blood vessel constriction. And so heart rates of, and by the way, it doesn't mean that it has to be that has to be the parameter. But what I mean is that's probably going to be one of the answer choices, that this is something that affects blood vessel constriction. But I also need to look at, because I have to consider that in this question, the answer choice may be an answer that's showing a side effect of the medication. Because like, for example, this is not true for this question, but there could be a question that had like, hey, phenylephrine has to be given through a central line, and maybe there's a sign of a central line infection or something like that. Or for like, norepinephrine, you can have side effects like tissue necrosis, or you can have, what is it called, tachycardia and stuff like that. So there can be other problems aside from just, hey, what does this medication do to hemodynamics? So always consider side effects of the medication as well as what it's actually supposed to be doing. So heart rate of 104. Well, their heart rate might be mildly elevated. That's only a slight elevation. I don't love it, but I don't know if I necessarily need to make a change as a result of it. So I'm going to keep going. MAP of 72. Well, that's a good MAP. I don't know. I don't have an order here, but at this point, I don't think that I need to change anything. Like it says, I would warrant the nurse to make a change to this infusion. And like, what, I guess I should have put immediately in this. But yes, what do you call that? We're probably going to be looking at which one is the most serious thing that needs to change. CVP of 8. So that's measuring fluid balance, and they have fluid on board. So that's not something, because like the one thing you always want to remember is we always have to give fluids first before we give vasopressors, because if I'm just squeezing and there's no fluid in my hose, then there's nothing to squeeze. So their CVP is in the normal range. So there's nothing that is going to need to be changed there. And then SVR of 1750. So the normal SVR, that's my vessel squeeze, is going to be 800 to 1200. So that is super high. So when you're looking at pairing all these, because I'm sure some of you were saying, how come in number 1, you had to titrate when the MAP was 72, but in this one, you're saying it's not the right answer? Well, I don't have an order that says what I need to titrate by in this one. And really, you want to see which one of these is the most serious. Like which one of these, like if I don't do something right now, something serious could happen. Having a MAP of 72 isn't going to kill you, even though you definitely want to come down on those pressors if you can, if your order says, depending on what your order says, to keep it above. But this SVR is super high. And so what this question wants you to connect is that if my SVR is that high, I may need to contact the doctor, and I will need to contact the doctor and let them know, because that is way above the normal range. And so we may need to stop that phenylephrine infusion. So the best answer here is going to be D, even if you don't like it. And I'm sorry, I'm not a perfect person. And sometimes I look at these questions later and I'm like, man, should have considered it. Because the sad thing is after you start teaching for a while, you start seeing all the ways that students can like fight and argue with you over questions. It makes it really hard. But just know this, it is incredibly hard to write questions. You should try to do it. It's actually a great way to study. It is incredibly hard and incredibly frustrating sometimes to write practice questions. So bear with me, but hopefully you get the overall picture there versus anything. So remember, these may not be perfect questions, but they will hopefully give you an idea about how you can start studying and start looking at this material and start kind of training your brain to what kind of situations can come up with hemodynamics. I'll see you for the next one.